How does your combination of being a psychiatrist and psychotherapist influence client work?
I think I have to go back to kind of some roots about my involvement in helping other people. I had parents who both were involved in various kinds of service to others. And within the family setting, whenever it was possible, my parents also involved me in the direct service of helping others. Sometimes it was a distribution of food. Sometimes it was the collection of money for charitable purposes, various things like that. So that there was the reward of understanding how much people appreciated what was offered to them. I think I liked that feeling, and that's probably what led me eventually to decide on medicine. My decision to enter training in psychiatry occurred while I was within the military service, subsequent to graduating from the medical school. So I chose psychiatry. At that point, I wouldn't say that psychotherapy was what I had intended. I did intend to be a physician, treating people with what then was referred to as mental illness. And I did so in a huge state-operated mental hospital that had more than 4,000 patients at all times. So I truly understood what it meant when you said people had serious mental illness, because these were people who could not live outside the hospital. Psychotherapy was something I decided on probably during my last year. And the problem was that there was nobody who could teach psychotherapy. I basically had to apply what I thought was common sense. I had learned, of course, psychoanalytic theory, but I was not intended to be a psychoanalyst. That was not an attractive option for me. And so I learned psychotherapy through a process of my own experimentation, plus supervision, discussion. And subsequent to completing my training, I assumed a position as the director of a community public mental health facility. And there I was immediately impressed with the fact that there were far more people seeking the services we had than we were capable of providing. And as a result of that, I decided that I needed to learn more about group psychotherapy, which, at least for the public clinic, was a way to extend my professional services to a larger population. Having found that was a satisfying experience of working with people within the group, I then decided that I wanted to teach group psychotherapy. And when I did that, I realized that there was a lot more I needed to know about group dynamics and psychotherapy in groups. And so I went searching for a possible program of education. And what I discovered in the United States at that time that there were only 3 formal programs teaching group psychotherapy. 2 were on the East Coast, which was relatively closer to me, and 1 was on the West Coast. So I commuted back and forth between Ohio and New York for 2 years, 1 day per week. That's where I learned most about group psychotherapy, because the learning opportunity was just exceptional. And it was with that my practice gradually shifted to be more psychotherapy with outpatients than working with inpatients, which had been the first part of my private practice.